Breakthroughs in research and medicine mean that diseases that were previously untreatable are today amenable to treatment. This is indeed welcome news for patients but creates challenges for health systems. How can European health systems continue to ensure access to expensive, innovative medicines and technologies in the face of pressures to be sustainable? How can cross-border collaboration to provide specialist training for doctors support the delivery of quality, highly specialized services? Can we address such challenges more effectively by working closely together in a structured and organized manner? What kind of support do we need from European institutions to achieve our goals? Our vision for future health systems cooperation is one based on voluntary cooperation models, backed by evidence. We believe a one-size-fits-all approach should be increasingly replaced by flexible frameworks, where member states can participate according to their specific needs. Tomorrow's health systems require different approaches and solutions to those we have implemented in the past. The following two examples highlight areas where cooperation can work to provide results for citizens, healthcare professionals, and funders. The development of European reference networks presents an exciting opportunity. Their success, however, lies in the formation of strong professional networks. These must support professional training, mobility, and cross-border communication. Only in this manner will the much-needed element of continuity of care be assured and diffusion of innovation facilitated. Deeper and more organized cooperation can be an effective strategy to improve access to innovative medicines and technologies. Significant improvement in the procurement planning, design, and post-purchase phases can be achieved, with benefits for patients, health systems, and industry in Europe. This requires a readiness from all stakeholders to engage in processes built on trust and transparency. It is only by working together more effectively that as national health policymakers we will succeed in sustaining high-quality health systems built on the European shared values of equity and solidarity.